Acute Respiratory Distress Syndrome, or ARDS, is a disease that lies within the spectrum of inflammatory conditions and is related to Systemic Inflammatory Response Syndrome, or SIRS. Essentially, ARDS is characterized by the inflammatory-mediated dilatation and leakage of capillaries, with movement of fluid from within the lumen of the vessel into the surrounding tissue, in response to a trigger or insult to the body. However, unlike in the case with SIRS, where capillary inflammation and leakage occurs throughout the body, in ARDS, it refers to the process occurring within the lungs, with leakage of the pulmonary vessels into the alveoli, resulting in acute pulmonary edema and hypoxia. When learning about ARDS, you may also hear mention of a condition called acute lung injury, or ALI. In simple terms, in both conditions, the same inflammatory process occurs, which disrupts the pulmonary endothelial epithelial barrier and causes pulmonary edema. But in acute lung injury, the effect upon the patient's oxygenation is less severe than occurs with ARDS. In terms of the incidence of ARDS, in the USA alone, an estimated 190,000 cases occur every year. In ICU patients, who are mechanically ventilated for more than 24 hours, ARDS occurs in approximately 16% of cases, so it's relatively common. The incidence of ARDS increases with age, with the highest incidence occurring in patients between the ages of 75 and 84. ARDS is a very serious disease, and something that's reflected by the mortality rate of the condition, which ranges between 26 and 58% of cases. Death in ARDS is often related to the onset of multi-organ dysfunction syndrome, rather than simple isolated lung injury. Interestingly, in patients who survive ARDS, it's not uncommon for them to suffer from some long-term pulmonary complications that can have a significant negative impact on the quality of their life. And we'll come back to the reasons for these long-term effects of ARDS later on in this series.